Groin pain is a common issue in sports medicine affecting athletes who perform repetitive hip movements and rapidly change of direction during running, such as football and basketball players. However, groin pain can also occur in those who participate in running. The causes of groin pain in runners can vary, including adductor-related groin pain, iliopsoas-related groin pain, and rectus abdominis-related groin pain. Another less common but frustrating injury is osteitis pubis, or pubic-related groin pain, which is usually seen in postpartum runners, middle-aged trail runners, and ultramarathon runners. Stress fractures in the pubic rami and femoral neck are also a common cause of groin pain in long-distance runners. Femoral stress injuries such as stress fractures can present with hip or groin pain that worsens with weight-bearing activity. At a later stage, they can progress to pain at rest, night pain, and inability to train. Therefore, it is good to practice to screen all runners with groin pain for potential stress fractures or bone stress injuries. Accurate diagnosis of groin pain is essential to guide appropriate management. Rehabilitation programs that focus on hip stability, strengthening the pelvic and lumbar region, and eccentric biased exercises have shown promise in improving running biomechanics and reducing groin pain in runners. So, in this video, we will show you how to start an early phase groin pain rehab program for runners, specifically in runners with adductor-related groin pain and osteitis pubis. Check out our online courses now. The link is in the video description. Hi and welcome back to Physiotutors. In the introduction to this video, I mentioned how important correct diagnosis is. For this reason, we have set up a free multi-hour course on diagnosing running-related injuries for you together with our running rehab instructor, Benoit Matthew. You can find it at the link in the video description down below. So, when a runner is seeking care for groin pain, the first key pillar of rehabilitation is proper education on the condition, course, and to outline a plan of care through shared decision-making. Acutely, pain management can be assisted by analgesics and adjunct treatments like soft tissue treatments or manual therapy to the hip. In our blog, Why Injured Runners Should Replace Their Lost Running Time, we highlight the findings of a 2020 study which concluded that injured runners do not replace lost running time with other physical activity and thus do not maintain their fitness levels, which could enable early return to running. Therefore, it's essential that you find ways to manage the training load appropriately and to switch out running for other cross-training activities that allow the patient to maintain a certain level of fitness without aggravating symptoms. In this early stage of rehab, hip mobility exercises play a vital role to improve pain-free range of motion into hip extension, abduction, and external rotation. It is really important that runners avoid aggressive passive stretching, especially in conditions like osteitis pubis, which can flare up symptoms. So, let us show you a couple of examples that you can use. You will also focus on loading the adductor complex in the early stage of rehab, but you'll do so gradually as to not aggravate tissues in the groin. They will constitute isometrics and bodyweight exercises. These will be progressed in the course of rehab. Here are a couple of examples for early loading of the adductors. Lastly, you also want to initiate loading of the lower abdominals due to their anatomical connection to the groin region. Again, we will progress these exercises in the course of the rehab program. In order to gauge when to progress to mid-stage rehab, we can handle the following criteria. In terms of pain and function, patients should have a normal gait, no limp, no night pain, and be able to sit or walk for 30 minutes without discomfort. Their mobility into hip extension and abduction should be within 10% of the contralateral side. At last, we can use some objective capacity testing of the involved regions. The patient should be able to do a prone plank hold for 30 seconds with no more than a 3 out of 10 pain on a VAS scale, as well as a 10-second adductor squeeze both at 0 degrees with a long lever and 45 degrees of hip flexion. Also with no more than a 3 out of 10 pain on a VAS scale. Alright, this was an introduction to groin pain rehab in runners and how you can initiate early stage management of these patients. Of course, there are a host of other exercises that you can use, so I am really curious to hear what your go-to ones are in the comments down below. This video is part of the extensive content update to our Running Rehab online course that we have developed together with Benoit Matthew. Mid-stage and late-stage groin rehab videos can be found in the course update. If you're interested, you can find a link to the course in the video description. As always, thanks a lot for watching, don't leave without a thumbs up, and I will see you in another video. Bye.